as we find more and more research discovers that patients heal better when they're in environments that they're familiar with. Let's go inside Missouri Alliance for Home Care to find out a little bit about this profession.
We've all heard the saying, there's no place like home. This is even more true when it comes to someone's healthcare needs. Home healthcare goes beyond the bedside. Every day in homes across our communities, there are unsung heroes who make a profound difference in people's lives by providing home healthcare services so those individuals can continue to live safely and independently in the comfort of their own homes. The world of home care is full of opportunities to make a positive impact.
So I decided to pursue healthcare. It was something that my grandparents had always wanted me to pursue whenever I was younger. And in my grandpa's last days, I watched the nurses and how they cared for him, how compassionate they were. And it really just clicked that this was something I wanted to do the rest of my life, to make that impact on these families like they made on us.
So I got into home health because I had worked several years in the hospital. And home health, you really have a one-on-one basis with them and you really can connect with them. And it's so beneficial for their family because they can do what they need to do for their daily living and get out and work if they want to work. And they're not separated. They're in their home where it's comfortable. And you know, there's no place like home.
There are a lot of different career opportunities in home health care. I started as a homemaker when I was in high school, going into people's homes, helping them out with things like cleaning, cooking their meals, helping them with bathing. It was something that I really enjoyed, I found.
Kind of nice to get to know people inside their home. You develop a pretty close relationship with them and the family. There are studies that show that that is very therapeutic and it helps them heal and stuff at home. So I really enjoy that. Many times these clients don't see anybody else. That's part of their socialization is when you come in, so that it means a lot to them.
You know, you're able to see your patients in their home setting, which is usually where they're most comfortable. You're able to kind of meet them where they are, see how they live, you know, make suggestions on modifications to keep them at home.
Home health care ranges from elderly to infants, newborns. I take care of the pediatric. I really like to play games and really get down on the floor with them and have a lot of fun. So they come out of the hospital and they need nursing, and some's long-term, some short-term, but if they need home health care so their parents can go to work, then you're there to provide that for them.
The impact that you can have, you get that one-on-one patient care with the patients and their families. You get more time. You're not as rushed to spend with the families and the patients, and you really get to see them progress towards their goals and achieve those goals together.
And there's so many different opportunities within the home health care field. There are things you can do scheduler, you can do office manager, you can do the homemaker, both skilled and non-skilled jobs where you can work your way through. There's opportunities for advancement, just a lot of things that fit the different schedules for different people.
You know, I was able to do billing and intake and scheduling while I was pursuing my career, doing my college classes, got into the RN program, graduated from the RN program, and was able to go back out into the field to do that direct patient care again for some time. And then there was an opportunity to come back into the office as a case manager, so I moved into that role. And then at that time, our administrator was retiring, so another opportunity to advance that much further, and I moved into the administrator role for home health.
So what attracted me to home health was the flexibility of scheduling and being able to make my own schedule. We work from home, we have a daily schedule. Once that's done and you can arrange your appointments when they want to be seen. I have some that want to be seen first thing in the morning, some want to be seen after, you know, a certain time. So that's kind of what I really like about this position, is just being so flexible, not having to go in at, you know, at 7 o'clock and getting off at a certain time.
I have been so blessed working in healthcare, in home healthcare, that I've never had to miss a single school event, a single extracurricular activity. for any of my 3 children. So flexibility is such a big thing with home health care. It's not only it's the flexibility during the day to adjust your schedule during the day, but also with your actual work schedule and your work hours. You can actually schedule, say I want to work 2 days a week, or say I want to work 3 days a week, or that I want to just be that pay-per-visit person who just, chooses maybe this week I want to work 20 hours, but next week I want to be off to be able to go and do something. With home care, all of those opportunities are there.
So I love my job because we are able to connect with those patients. We're able to meet those goals with them. We're able to meet them where they are and really make an impact in their lives, their care. We keep them at home longer than they would traditionally be able to be home. We're able to work with their family members to empower them how to take care of that family member and keep them home longer, which is so important. And we're able to connect with them on a level and get that more time with them than what we would in a more traditional setting.
It is an opportunity to go and see people where they live, to be in their environment, to be in their home, to be able to keep them in their homes and allow them to stay there. And the appreciation that you get from them is the most rewarding experience I think that you can have.
I love my job. It's so flexible, and I love the family, and I love my client, and it's so rewarding every day to be appreciated when you go to work, because I truly am appreciated by my family and the client.
I would say the most rewarding thing with my nursing career in home health is to see clients heal at home. That's the most important thing.
So whether you're considering a career in home care or just want to support this vital field, remember, it's about making a difference, one person at a time. You can explore home care opportunities within your community by reaching out to agencies in your area or by contacting the Missouri Alliance for Home Care.
Great to see inside the world of home health care. And with us today is Peggy Bone, Secretary of Missouri Alliance of Home Health Care, as well as she's the Area Vice President for Missouri Skilled Home Health, and Valerie Norblit, Director of Home Care Services for Citizens Memorial Foundation. In fact, Citizens was last year's Behavioral Health Spotlight. Welcome, Peggy and Valerie.
Thank you so much for having us.
Well, why don't you go ahead and give a little bit about what you do, and then we'll take some Q&A already from students.
Absolutely. So I started in home health about 28 years ago. I started as a nurse. I had worked in the hospital, and due to having children and schedules, I needed a little more flexibility. So I went into home health and did home health and hospice. My grandfather had been on hospice, and I had watched the nurse and everything that she did, and I really admired them and thought, hey, I think I can do this. And so I'm still in that same organization. I've been there 33 years. There's lots of growth in home care. You start as a nurse or a physical therapy assistant, and then you can move your way up. We have lots of different disciplines that work in home care. It's not just for nurses. We have CNAs that work in home care. We have physical therapists, speech therapists, occupational therapists. We also have transportation companies that we work with. And so we need people to drive patients to the doctor's appointments. Our big goal in home health is to keep people at home. So we want them to be at home. We know, as our video said, that home is where folks want to be. And so our goal is to take care of them at home. We do lots of skills. So if you're thinking about what kinds of things you would see or do, we do IVs at home. We have wounds. We have wound vacs. Lots of things that you can do in the home environment. It's basically kind of like a med-surg unit at home, except we're doing the care in the patient's home. Hospice care is for end of life. And so patients that are terminally ill, we try to keep them at home and manage their pain and any symptoms they have so that they can die at home with their family around them. We also have in-home aides. We have personal care that works. We have people that clean houses, just lots of different options and things that you can do in the home care field. You can come in out of high school and start doing things. You can get your CNA and start seeing patients in that route. Or like I said, if you want to be an in-home caregiver, then we teach you those skills. And so you can do that right out of high school. Things that you should do to try to prepare if you want to be in home care depends on which discipline you want to be. If you want to be a nurse, then of course you go to nursing school. If you want to be a therapist, then you go to the therapy school. We also have some respiratory therapists in home care that help patients. Again, we have patients on ventilators at home. So anything you can think of, we can do it at home. So love our job, and our staff, I think, love home care for the flexibility. So I'm going to turn it over to Peggy.
Hi, I am Peggy Bone, and I started in home care back in 1996. I went to a junior college to get my associate's degree after high school and become an RN. And started out in the hospital setting, and I really enjoyed working the hospitals, but like that night shift got daunting. Home health is mostly Monday through Friday, 8 to 5. We do rotate on the weekends and take call. So that was appealing to me. And so was the fact that I got to sit down on a couch and not just bounce in and out of rooms taking care of patients. I got to really connect and be there for those parents and grandparents that I got to help, not only stay at home, but stay at home and be healthier and stay longer with their loved ones.
Yeah, I think that's one of the key things to home healthcare is that you can help them just kind of improve in their own way in their own home, which is very comforting for many, especially elderly that they don't like to be in those type of facilities that are more extended stay long-term care facilities. They'd rather be at home. They'd rather get back into the game with somebody like you help them. We have some great questions coming in, so we'll go ahead and go to those questions. A student from Valley Park High School. Is hospice care considered part of the home health care umbrella? Good question.
Yes, it is. So when we look at home care, we say that's home health and hospice. So they both are under the same umbrella, and most agencies do have both of those.
Okay, and then Hickman High School in Columbia asks, what is the hardest part about being a home health care provider and why? Good question, Hickman.
That is a good question, and I will take this one. I think I'm going to mention two things. Number one, you have to be really self-disciplined because we talked about the flexibility, but that also means you need to get up, get your day going. You're not clocking in and out. So there's a lot of accountability to get your work done in a timely fashion so that your patients get seen, your documentation gets done, and then so that you're not spending hours and hours and hours doing things later in the evening. The second part is making sure professional boundaries. You get into a patient and you feel like you're becoming their family, and you really are in some ways. You become that person for them, but you also need to watch for professional boundaries because we're still providing a professional service, even though we start to care for each and every one of our families.
You mentioned about that, and one of the students actually asked a question, as far as an employee in home health care, do you receive any type of mental health therapy to handle some of the stressors of your job?
So we do have social workers that work with us. We do have debriefings if there's something, a crisis that happens in home care. We do debriefings after that. We also offer employee assistance program to our employees so that they can get some counseling if they feel like they need that service.
Yeah, and we saw earlier today from Missouri Behavioral Health Council about the benefits of mental health, and that you need to really pay attention to what's going on in your mind and how you're handling the stressors of your life. Another question, Peggy, this is for you. What community college did you attend?
Well, I have to give a shout out to Mineral Area College in Park Hills, Missouri. I attended there in the 90s and was on their volleyball team.
Do you still play volleyball?
I do not still play, but my daughter is now attending that same junior college, and I am now a cross-country mom, and I cheer for her on the sidelines.
Nice. Very good. Very good. One last question for you. Do home health care workers have to have a BSN degree? Good question.
So you do not have to have a BSN degree to work in home care. However, I will tell you, if you want to be in management or leadership in home care, that all of my leadership positions in the office do have BSNs.
Okay.
And if I could piggyback off of that, I did start out at that junior college and then life happened. And I always said I was going to go back to school and get my BSN. And I had a long career, and I will tell you, I graduate with my BSN this spring. So even though it's never too late to go back and get further education.
Fantastic. And I hope that volleyball player daughter shows up for your graduation and cheers you on.
I hope so, too.
Well, thank you so much for joining us for Healthcare Career Day, Valerie and Peggy. And we're going to share some more resources for individuals that are looking to go into home health care. But thank you for joining us today on Healthcare Career Day.
It's our pleasure. Thank you for having us.